Hello, this is Graham Brown, Principal with NextGen Advisors. Welcome to our podcast series featuring senior leaders from the NextGen Advisors team. I'm joined today by my colleagues Chris Emper, Dr. Marty Lustig, and Dr. Betty Rabinowitz. Welcome to each of you.
Hello.
Hey, Graham.
Hey, Graham.
With the beginning of the Biden administration this week, we've asked Chris, as an expert on federal policy, to share his thoughts on the implications of these changes on healthcare. Chris, let's start with the nominees to some of the key positions, from Health and Human Services to the CDC to the COVID-19 Task Force in the Surgeon General's office. What can you tell us about who's been nominated and what positions are yet to be determined, what that process looks like, and why it's important for healthcare leaders to pay attention to this?
Great question, Graham, and thanks for having me today. I think it's always important at the beginning of any administration to realize that a lot of the actions that will come most immediately will come through executive orders and regulatory changes. And leading those changes will be the new nominees and appointees to the top positions. And across the U.S. Department of Health and Human Services, there are a number of different key positions that will be turning over or have turned over. Atop the list is the nominee for the Department of Health as the Secretary of HHS, who is Javier Becerra, the current Attorney General of California, who's a former member of Congress from the state of California. His background comes obviously as a congressman. He was a supporter and advocate of the Affordable Care Act as a member of Congress and actually led several lawsuits as Attorney General of California against the Trump administration around the Affordable Care Act. So he sort of brings that legal background as a proponent of the Affordable Care Act to the table. Looking beyond the top position as the Secretary of HHS, a number of other different nominees have been named by the Biden administration. You have from the state level, the Secretaries of Health from the state of Pennsylvania and Wisconsin as the top deputies under HHS. The former Surgeon General Vivek Murthy under the Obama administration is going to come back into that role and will play a key role in the COVID response. And then Dr. Anthony Fauci, I think, is another notable one who was the top medical advisor under the previous administration, is going to continue on that role and play a leading role in the COVID response under the Biden administration. It'll be interesting to see how quickly some of those nominees actually get in and as they go through the Senate confirmation process. But back to your most important question, I think, in this, why should we care? It's that, as the plans turn into actual policy and impact the industry, it'll be these individuals who will be leading those efforts over the next week, the next following weeks and months.
That's great. Well, lots to come. I think important for us to be paying attention. Marty, there's a number of physicians that have been on the list of new appointees. Thoughts on that and how that might cast a shadow on things?
Yeah, I certainly don't have in-depth knowledge on each of the appointees. To me, the reassuring thing about this list of appointments was really the comments that were made around the appointments of that, science is going to be placed at the center of health policy decisions. So having, whether it's clinical expertise or public health expertise that's driving the decisions, particularly as it relates to managing the pandemic, as well as the longer term policy issues, I think to me is a really important part of this whole thing.
Thank you. So Chris, let's turn to the changes in Congress. There's pretty thin margins in both houses that we can. So what can we see, do you think, in terms of legislative action if there's just that razor thin margin and not a broad amount of support on some of the more controversial issues?
Yeah, I think, the biggest change in D.C. beyond the presidential administration from last year to this year is that the Senate, as a result of the recent Georgia special runoff election, has flipped majority control from the Republicans to the Democrats. It's actually split 50-50 in terms of senators, with 50 Republicans and 50 Democrats, but with the vice president being the president of the Senate, new Vice President Kamala Harris will be the 51st and decisive vote. So with those margins, though, being 51 to 50, it's going to be tough to get major partisan legislation through. A bipartisan approach that can garner 60 votes in the Senate, which is sort of the magic number you need to get to move regular legislation will certainly be the easiest path forward towards passing major COVID relief or healthcare legislation. But just with 51 votes, it is possible for them to push legislation. And actually, over the last decade, this is the process by which we saw the original passage of the Affordable Care Act and several of the major legislative accomplishments under the Trump administration, including the big tax bill. So there is precedent for that happening before, especially around healthcare, and I think they'll use that process. One of the things that I think will be, different as we look at a different control of Congress and a different agenda under the Biden administration is COVID relief and COVID relief packages. And President Biden has already put out a $1.9 trillion plan for the next round of COVID relief. How quickly and whether that makes it through Congress remains to be seen over the next few weeks. But I think that a major focus on some of those initiatives that did not make it into the COVID relief bills that were ultimately signed into law last year is something we're going to see great attention to this year. And then, beyond that, looking at the broader healthcare policy world and the changes that President Biden campaigned on, I think what ends up happening with the pandemic over the next several months and how much attention that requires and the ability of the Congress to focus on other issues will largely dictate whether they go to pass a major or put effort into passing a major healthcare reform bill earlier in the administration, or sort of put that on the back burner as the pandemic occupies all of Washington's time over the course of this year.
So let's go a little deeper into that. Aside from the vaccination issues, what can we expect to see in the continuing federal response, really from the economic side, to the distress that's been caused by the pandemic? There's elements in Biden's plan, as you referenced, and there's been a couple different versions of support promulgated financially back in March and then at the end of the year. What else might we expect in that regard?
So the proposals that the president has put forth as part of his $1.9 trillion plan bucket relief and kind of divide up that $1.9 trillion in a couple different areas. The first one is a continuation and probably an increase in the support for individuals and families in terms of expanded unemployment insurance and direct relief payments to individuals and families. The second bucket is more focused on state and local governments, and this was something that was a big hang-up in the bills that did not pass and get signed into law last year, but something that the Democratic Party has put a lot of support behind, giving money to state and local governments, not only for the pandemic response, but for other sort of related issues where there's been some budgetary problems. And then the third is more focused around, businesses and longer-term, changes. And when Biden rolled out his plan for kind of what he called the first round of COVID aid, the $1.9 trillion, he also said that coming beyond that would be another bill that potentially would be even larger, that would look to do some more fundamental things beyond just the COVID pandemic, some what he called his rebuild plan towards the economy. So I think putting those two things together, and obviously it will require congressional approval, potentially a lot of changes coming over the next few months, and it'll be certainly interesting to see how it all plays out.
Great, thanks. So the pandemic has clearly been a dominant theme in healthcare for the past year, but there's lots of other aspects of healthcare policy that are likely to be prioritized by the new administration. What do you think some of those topics might be?
Well, again, as you noted, COVID is issue probably number 1, 2, 3, 4 for the administration right now, and will demand, the majority of their response. But beyond COVID, the Affordable Care Act, and remember that Obamacare, then Vice President, now President Biden, was a big proponent of that, and it's not only a legacy issue for former President Obama, but as his Vice President, it's a legacy issue for Biden as well. And I think changing and sort of reversing some of the policies that were in effect the last few years around the Affordable Care Act will be a major initiative of the Biden administration. And a couple of the legislative proposals that he has already put forward and campaigned on are to add a public option around the individual market exchanges and to increase the value of the tax credit subsidies to make those plans on the exchanges now a little bit more affordable. Another area, beyond the Affordable Care Act is a broader policy of attacking coverage expansion. And he's talked about both through Medicaid and Medicare, looking to increase enrollment in those programs through various different policies. Of course, those changes would require legislative approval. And as is always the case, they're sort of the sacred cows, the entitlement programs that are difficult to change and require a lot of support, and usually bipartisan support. So we'll see what happens on those fronts. But that's definitely another area that I would expect some action on. And then the fourth is around disparities, and this is something that the administration has made one of the major planks of their overall administrative response and a priority. But I think in healthcare, certainly as it relates to COVID, but also issues beyond COVID, I think this is an area where there could be a lot of activity. And I think particularly as you look at community health centers, they have been identified as one area that can play a major role in that response.
Betty, I'd love your thoughts on what some of those policy initiatives around expanding some of the coverage options through the Affordable Care Act, as well as that focus on disparities, might mean for healthcare providers.
I think that a couple of things. One is that those model of care that have been successful heretofore, for example, federally qualified clinics, will become some of the lessons learned there, and some of those models may be expanded. I think the integration of behavioral health will continue and expand. I think part and parcel of reducing disparities is the disparities between coverage for physical and kind of traditional healthcare and behavioral health will become more important, and we'll see more integrated care. I'm hopeful that one of the biggest impacts will be the continuation of the acceleration of focus on primary care, and that there will be an emphasis on the importance of primary care in reducing disparities, serving broader populations, and kind of recruiting the best and the brightest to primary care, continuing to build models of care that primary care young physicians want to continue going into primary care.
Marty?
I actually would like to ask Chris a more specific question. I know it puts you on the spot, and you probably can't give a real clear one, but from a crystal ball perspective, how likely is it that they'll be able to get legislation through around telehealth that'll make the changes related to the pandemic permanent for the government, for both Medicare and Medicaid?
That's a great question. I think that's actually one area where I do not see a lot of room between the parties in terms of their political or ideological beliefs. And I think telehealth really is wrapped around this whole transition to value-based care and a lot of the initiatives that have received bipartisan support. And if you remember back 4 years ago, President Trump came into office and his big healthcare policy plan was to repeal Obamacare. And as part of Obamacare, a lot of the value-based care initiatives were wrapped up in that. And there was a lot of confusion in the industry as to, does this stuff all just go away? And I think 4 years later, we can confidently say that, one of the main, if not the main, legacy of the Trump administration's healthcare policies is that value-based care and a lot of these initiatives are going to be permanent. ACOs, telehealth, interoperability. And I think for telehealth, it's really just a matter of when, how, and to what extent a new bill gets passed. There's been a lot of discussion since the pandemic started about, once the pandemic ends and the national emergency period ends, all these policies go away, and, are we going to keep them? Are we going to modify them? And I think it's extremely likely that that will happen. But at the same time, it's difficult to say exactly when and exactly how.
Yeah, I think from the provider's perspective, there's been so much investment in developing those capabilities in response to the pandemic that it would be really helpful to them to know what the landscape's going to look like going forward.
Yeah, and I think one thing that'll really help it is looking back at what had hindered telehealth and the federal adoption of more reimbursement for telehealth prior to the pandemic is that they didn't have any data that showed, telehealth services is going to be a success from a money saving standpoint, from a cost standpoint. And that was always, one of the theses behind the adoption of telehealth. It's a lower cost service. It's going to be better for patients. It keeps them, out of the hospital. And I think now we're just starting to see some of the data from the pandemic on that area come in. And if that comes in a positive way, I think that'll really give Congress the evidence they need to make some more permanent changes. So I think a lot of folks are very hopeful in that area.
So I'm going to borrow Marty's approach here, whether it's a crystal ball or not, maybe a fuzzy crystal ball. But I'd love to hear from each of you. Is there anything that you don't think is going to change going forward in the realm of healthcare reform or policy? Marty, do you want to start?
Yeah, I don't know that it won't happen, but to me, Chris is the political expert here, but I think the likelihood of expanding Medicare is going to be harder to get through as lowering the age for Medicare, particularly given the solvency issues that Medicare already faces. It seems to me the least likely component of the Biden plan that's going to get through, particularly a pretty divided Congress.
Betty?
I think that one thing that won't change is that the pressure to continue reducing costs will be there, and that the entire pie is going to shrink. The way it's divided internally will be different, but I think that's one given. And the second is, particularly because of the things Chris pointed out, that in spite of the previous administration's attempt to kind of abolish the Affordable Care Act, there has been a steady bipartisan commitment to value-based care that I think will continue. So new risk models, new primary care models, strengthening of ACOs and expanding their reach, bundle payments for specialists, I think are themes and common kind of models that we will continue seeing. I don't think that's going to change. If anything, will be accelerated.
Chris, what would you add?
I think the two doctors really nailed it on the head. As I was just talking around telehealth, I think the broader movement towards value-based care is going to continue. And when you think about, from a physicians or a physicians group perspective, what are the big changes you have to be aware of in the short term, and what might change your day-to-day life? The broader coverage changes, the future of Medicare and Medicaid, those problems and those issues, I should say, are ones that are going to be fought during this administration and through future administrations. They're sort of classic Republican versus Democrats, how do we tax and spend type issues. But how do we actually spend our healthcare dollars from a federal perspective? The focus on lower costs, and also during the pandemic, as telehealth, as a perfect example, has highlighted, consumers are demanding a better experience. And I think it's exposed some of the flaws in the fee-for-service system. And I think the value-based payments, ACOs, telehealth, interoperability, all those things that are wrapped up in value-based reimbursement and sort of care redesign are things that are going to continue to accelerate. And my final point, I'll just say, I think no better example of that is the bipartisan proposal that's now been enacted in January 1st of 2021 to reform the 2 decades old evaluation and management coding and payment system. During a pandemic, during a presidential administration, the industry led by the American Medical Association and their CPT editorial board was able to partner with the government, CMS, and implement this massive change that's 2 decades in the making. And again, during a presidential transition, during a pandemic, and I think that gives some evidence to the fact that this transition is moving forward and will not change as a result of the political changes.
Excellent. Well, thank you all. Very interesting conversation. I imagine there's going to be a huge amount happening in this space over the next several years with the new Congress, new administration, and new Senates. So keep tuned to this channel. I'd like to thank Chris Emper for joining us today, along with Dr. Betty Rabinowitz and Dr. Marty Lustek. And thanks to our listeners. If you want to stay tuned to this channel, consider subscribing to our podcast. This is Graham Brown with NextGen Healthcare. Thanks for joining us and have a great day.